Okay, so I know Owens showed us a knee MRI and didn't really elaborate too much, but I have a DICOM and a MRI image, so if anyone is interested, I'm just gonna like go through it so you can kind of see, because I think you kind of need a 3D perspective in order to really understand what the hell you're looking at. So this is a right knee. This was my imaging after I tore my ACL. So we're going from P to A. So I started at the gastroc, and this is a T2. So we're looking for white fluid buildup, white water content, right? And I just want to like stop right there because you see this like really white signal right here in the intercondylar notch. So that is what we call an empty notch sign, and it's just like a lot of fluid buildup and a discontinuity from the femoral condyle, the ACL. So like I pulled up a Google image somewhere. Yeah, so this is a T1, but whatever. You can still see the empty notch sign regardless. So this is an empty notch, and this is what it should look like. And that is an indication of an ACL tear. So I'm going to keep going anterior. So then you get to the patella. So, and I'll just go backwards really quick so you can see. Also, in these images, you can also like assess for meniscal tears if you want to see if you kind of see a discontinuation maybe. But you kind of got to get good at looking at them. I'm not super good at looking at imaging, but this is kind of like basic stuff. So this is a lateral meniscal tear that you can obviously see something is in that joint space that should not be there, and it could be floating in there, and this is where it is fine, and this is what it should look like, but nothing should be in this joint space, and if it is there, it could cause like locking, or it could be a flap that just keeps flapping over back and forth when like you flex and extend the knee, so it's not super comfortable. Anyway, so you can also see the empty notch sign in your T1 as well. So this is a P to A again on the right knee. So I'm going from posterior to anterior, and there it is. You can also see some bony changes as well. So you can see the darkening of the medial tibial plateau and the lateral femoral condyle if you keep going. And that's because it was a pivot shift injury where in closed chain, the foot is on the ground and the tibia you can't really move, so the in closed chain the femur moves on the tibia, and what happens with a pivot shift ACL tear, it's a twisting mechanism where the lateral femoral condyle ends up hitting the medial tibial plateau and then causing a lot of bone bruising, and the medial tibial plateau kind of takes a while to heal. So I'll just keep going anterior, and you'll eventually see the patella. So I'm going to go backwards real quick just so you can see that again. And this is where, again, like you can kind of look for changes of the meniscus, but I'm not super good at looking at that, so I'm not going to go too far. All right, one more is lateral. So this is, again, right knee. We're going from medial to lateral. And how you can confirm, if you don't have any writing on it, how you can confirm that it's medial is because you don't see a fibular head. At least that's what I look for. So there's an intact PCL there, and because this is, your T1, you want to see a like big black band, fibrous band, and you want to see from proximal to distal that it's intact, because when you're going from medial to lateral on a right knee, so I'm just going to pull this up. So this is a right knee. This is a posterior view, right? So posterior view, you should see the PCL before the ACL. From a sagittal view, from the medial to lateral, if I'm looking at an image going medial to lateral, I will again run into the PCL before I see the ACL. But if I was going from lateral to medial, but I would see the fibular head, so I would know that that I'm looking from lateral to medial. It'll be the opposite. And same thing with the anterior view. I removed the patella so that you could see the ligaments, but you're going to run into the ACL before the PCL if you're going from A to P. So just to kind of help orient you, so I'm going to start medial again. So you can start to see the condyles, and there's a solid PCL, and then that's where the ACL should be, but there's a lot of fluid and a discontinuous like blur. It's just nothing, you know. So there is another indication for an ACL tear. And then even in your sagittal views, you can also see the bony changes as well. So going from medial to lateral, you can kind of see darkening of the femoral condyle. And I don't know what that is. It must be like a, I don't know, an osteoma or something. Hopefully I don't get bone cancer. Anyway, and then your medial tibial plateau, kind of see some bony changes. And then just to see it on the T2 to kind of help see that. And already you can really see a lot of fluid buildup behind the patella, because fluid just kind of goes the path of least resistance, right? All right, again, so we're going medial to lateral, so I hit my PCL first, and right behind it, a little bit more lateral, should be an ACL, but I just get a lot of white signal, and so that's bad. And I'll just keep going lateral so you can keep seeing. And then there's the bony changes that are a little bit more obvious on the T2. So I'll go backwards from lateral to medial. So, and there's the ACL, PCL, and again, I don't know what that is. I'm just hoping that's nothing. So yeah, I don't know if that helps anyone, but I find it interesting. Maybe you will see imaging in your practice. Maybe you won't. Only time I ever really saw it is if you asked for it, or if you worked for a hospital system like Centera or CHKD or something. I started looking at them during my clinical at CHKD, and that's how I learned to like view them. But if you have an in-house patient from an in-house doctor or whatever, and they send you to the in-house clinic, all of the EMR, electronic medical record stuff is all in the same chart. So you can literally pull up an entire chart of a patient's medical records because you're on the same system. So sometimes you can access them if you're just curious or you just want to look at an image, because the doctor will not show you or send it to you. Okay, that's it. Sorry it was so long.